Annie Spence, Unbreakable Strength Company. Here we are. How did we do last time?
You ran long.
A little long. Okay.
We'll keep it brief. We'll keep
All right.
it brief.
We're gonna be good
concise.
this time. So, foundations of fitness. What do you, if you had to list the pillars of fitness, what are the foundations of fitness?
Absolutely. I think that fundamental cardiovascular health is really important, right? I think that there's kind of this history of people are like, cardio kills your gains, and doesn't really do very good to be strong and muscular if you're winded going up the stairs constantly, right? And so I think our aerobic fitness is really the underpinning from how we recover from our strength training. It gives us a greater capacity to do more strength and sport training. And so, I usually like to get my clients' resting heart rate, like normal resting heart rate, 60 to 100 beats a minute. I like to get people as close to 60 or even under 60 as much as we can. So looking at heart rate and aerobic capacity is important. And then I think fundamental body weight strength, right? So being able to do things like squats, push-ups, wall sits, planks, pull-ups, chin-ups, things like that really underpin a lot of our global capacity. And then when we're structuring a weightlifting program, a lot of the times I'll have a client come in and, there's all these, the functional movement screen, whatever, there's all these personal training companies make fitness assessments, and really a lot of those are to make the practitioner feel like they're doing something valuable or to elevate their status image-wise to the client. Really what matters is, do you have a bone structure that can move? What is your joint health like? If you have a bone structure that struggles to move in a particular area, or you have a joint that's unhealthy, or in the case of developmental disability, you have some type of skeletal formation that's non-normative, then we want to look at what that function is like. What type of internal and external rotation do you have available to you? Where will your skeleton move? And then after that, all of our soft tissues piled on top. And so then we look at training, through ranges of motion that maybe we struggle with, or through ranges of motion that we're less resilient in, and assign exercises based on that, and then ultimately around what a person's strength goals are.
So I think I heard cardio.
Cardio's good.
Strength.
Yeah.
Range of motion.
Yes, that's it.
Okay.
That's
All
it.
right.
That's it. That's pretty much it.
Okay.
Yeah.
Sounds good. Yep. So when do you approach all three of these equally, or is it based on the client? Like, hey, they're pretty strong, but they need a little.
Yep.
Yeah?
Absolutely.
So it's pretty customized.
It's pretty customized. Yeah. So I think that those are kind of like you said, right? Cardio, strength, and range of motion are the things that everybody needs, and that's universal, whether you do sports or don't do sports, you're young, you're old, whatever. And then based on that, really, like a lot of my programming, like I don't kind of cookie cutter things for people. It's like you come in the door, we do our range of motion assessment. A lot of times we look at table tests and see what your range of motion is like, and then we say, hey, how often can you train? What's your gym access like? Like, do you have a gym? Are you doing things at home, right? And I think that you can kind of make any equipment situation work for people depending on what they have accessible to them and the time that they have available to them. And then we select exercises based around that. So like you said, right, every now and then we'll have people, like I work with Isaac. Isaac. Mm-hmm. Isaac's really strong. He's a bare knuckle boxer, right? There's
not a genius.
There's nothing I'm gonna do.
He actually is.
He is a genius.
He's
genius, like freaking biochemistry, molecular.
What the hell's wrong
something.
with you, Isaac?
I don't know.
Yeah.
So smart a
Probably
caveman could do it.
Yeah,
sort of
right?
so easy. Yeah.
So we started training last year, and he's already a professional bare knuckle boxer. I'm not gonna make him better at boxing in the conventional sense, right? And he's already benching over 300 pounds for reps. So making him too much stronger probably isn't going to do a lot for him as an athlete. But what we can do is say, hey, where do you wind up with chronic joint pain? And where do you struggle with mobility? And can we improve those things and let you move more efficiently and more effectively? That's going to make you, less likely to get hurt during a fight. It's going to give you access to more of the strength and tissue that you do have if your joint structures are healthy. And then beyond that, looking at maybe more specific conditioning methods to say, like, okay, a lot of fighters are able to, they can go for runs for a long time, but they'll struggle, like, okay, when I go to altitude, my legs get really heavy feeling. What do I do? And then
I think
it's like,
we saw that fight.
We look at,
Didn't we, Isaac? Didn't we see that fight at altitude?
Richmond, the fight at altitude. And he was like, my legs gasped. And so, I think that some of that is then like, okay, we look at your lower body's ability to cope with blood flow and to cope with lactate and to cope with kind of like being able to carry on your conditioning, and so then we improve those specific things. So I think looking at whatever the lowest hanging fruit for an individual is and then trying to clear that out of the way first is really kind of paramount. But then at the end of that is just really like cardio, strength, and range of motion for everyone.
Is there one of those three that just habitually are harder are harder to make gains in? Because
Yeah,
it seems like once you start running, it gets better kind of fast. And
for sure.
lifting sort of the same thing, but
Yep.
I can't gain anything range of motion.
Yeah, right. Well, I think that the flexibility conversation is interesting because we all, everybody's like, oh, I stretch for like 5 minutes at the end of my session and then I just never get more flexible. And I think some of that has to do with how we program mobility work and how serious we treat it, right? Like everybody's stoked to go bench press,
Yeah, right.
right? And so we spend a lot of time on it and we give a lot of effort to it. But I think really effective mobility training is a type of strength training. And so looking at using isometrics, isometric contractions, or actually direct loading in some of our stretching work can be a really good way to make robust mobility gains. But that definitely tends to be like big range of motion improvements. Tend to be a thing that takes a lot of time and it takes a lot of homework on the part of the person, right? It's like you can lift heavy 2 or 3 days a week and fairly well consistently get stronger without a lot of effort outside of that. And likewise, if you go for a run a couple times a week, or you ride your bike, or you swing your kettlebell, your cardio is going to improve. And I think like improving joint range of motion and getting really, really flexible is something that takes more of a kind of daily effort, right? Like brushing and flossing your teeth. And I think that adherence level is hard to get out of people, and I think fairly so. I get it that we're all busy, but it definitely takes, I think, a little more daily effort for sure.
One of the things that when I was young, maybe did without thinking about, but it seemed like everything was about, hey, how motivated are you to do a specific thing?
Yeah.
Like, how motivated are you to bench 350?
Right.
Except that now, it seems like I'm fairly motivated, but I don't have any dedication or consistency at all. So you get no results. If you
absolutely. If you don't show up consistently.
Yeah. Even when you don't do something good, it's better to show up and have a bad day than.
Yeah, absolutely. And I think that I think we get really attached to our good days in weightlifting, and then we get really rejectionary and uncomfortable with our bad days in weightlifting. And really, like, if you have 5 years of very average days of training stacked, that's going to get you more progress, right? And I think that some of it is just showing up no matter what. Like, something is better than nothing, and that's kind of maybe trite sounding to say or cliche a little bit, but I think doing what you can with the time that you have is more important. And I think sometimes people will be like, well, I haven't trained for a while, I'm going to start with 6 days a week and I'm going to do it. And then invariably that's not really super achievable for most of us right away. So then we don't do it and we feel bad and then we stop completely. And I think that, like, I would rather have more people be like, I'm going to give it everything I've got 1 or 2 days a week, and I'm going to do that consistently for 6 months. And then once it's been achievable, I'm going to add a day. That starting, slow and steady really does, in the long term, I think, wind up being better. And I think, kind of letting go of this idea that every day, like, you're not going to set a PR every day. You're probably going to feel pretty average. Like, I'm sure that, I don't know, if I were to come out and shoot here every day would be pretty average for me right now. I'm sure you guys are doing really great.
He's doing really good. I'm pretty average.
But I think, like, I'm sure you guys have clients that come out and it's like, okay, yeah, you want to, like, hit all your targets and you want to score really high and on the competition or whatever it is that you're doing. And it's like, you have to come out here and fire again and have it be probably pretty average most of the time to start stacking up a bunch of really good days. And I think that weight training is exactly the same.
So why don't we talk about, like, for the average person, like you said, if you lifted 2 to 3 days a week and you maybe, but what are these freaks like Rich, what was his name?
Rich Froning.
They said this guy worked out 5 times a day. You know what I mean? Sometimes like we're in, Broderick's got a friend in his unit that just, if he wakes up at 3 a.m, he doesn't go back to sleep. He just goes and squats or deadlifts or, you know what I mean? He's just one of these freaks that can just do, and then he'll do the PT and all the other stuff when it's time. But you know what I mean? He's just, but so what is it in terms of recovery for the average person? You know what I mean? Like, because that's something I've always struggled with, is recovery. Even when I was young, I didn't recover like other people did.
Yeah, absolutely. I think that really, like, if we look at what gives people health and longevity, that's getting like 150 minutes of moderate intensity cardiovascular activity a week, 2 days a week of strength training, and some type of mobility work throughout the week. And really, like, you don't have to want to be like people like Rich Froning. He was a CrossFit Games athlete, right? And so I think, like, you have to account for, I think a pretty copious amount of the people at the CrossFit Games are enhanced in some sort of way, and that makes your recovery better. But B, these are people who they don't have like a full-time job, right? This is not somebody
Right, that
going
is
to
true.
a 9 to 5. This is somebody who like their whole job is to train. So then their 9 to 5 is pretty much being in the gym. And I think especially with CrossFit, right? We see these CrossFit athletes and we're like, wow, if I just go to my local CrossFit box and do a couple WODs a week, like I'll be like that person. And these guys have a gymnastics coach that they spend time with. Then they have their Olympic weightlifting coach that they spend time with. Then they have the like dude that teaches them how to row on the rower. That's like their cardiovascular conditioning coach. And I think that like they have such a large support staff that what it looks like on the outside is like this person's really motivated. They train 5 times a day, and on the outside they've got like a whole crew of people that are helping them accomplish this. And this is their source of income. So I think that like for the average person, just focusing on like getting some type of strength work in 2 or 3 days a week. It can be body weight, it can be at the gym, whatever tools or resources you have, as long as we're working in this kind of, we kind of, I like to measure things in RPE, right? It's like rating of perceived exertion, RP10 being like, that's all you could possibly do. If we're working in that like 8 to 9 zone, sometimes in 7, sometimes in 10, on a consistent basis 1 or 2 days a week, you're going to improve and you're going to move better and feel better and struggle less with your activities of daily living. And then as far as recovery goes, getting enough protein in, drinking your water, and sleeping, I know that 8 hours a night isn't necessarily feasible for everybody, but getting as much quality sleep as possible within the structure of your life really covers 99% of it.
Really? So
Yeah,
hydration,
absolutely. Yep.
sleep,
And eating enough.
Yeah, just
Yeah. I think that there are, for people who want to lose weight, obviously, right, you have to start eating a little less. But I think that like starving yourself also doesn't necessarily make gains. So I think eating enough that you're recovering well and sleeping well, and then I think supplementation wise, I'm not a trainer that pushes a bunch of like big supplements, but there's a lot of really incredible, robust research on creatine. Right, it's been around since. I think we have some of the earliest research papers on it are from the 40s. They're now using higher doses of it in clinical populations and aging populations that are struggling with dementia and Alzheimer's, and it's improving cognitive performance. So I think that like creatine is, as far as an additional recovery thing, incredibly safe, incredibly cheap, and helps with both physical recovery but also cognitive energy for pretty much everybody. And it also protects against brain injury. There have been some studies on TBIs and concussions, and creatine reduces the risk for that too, which I think is important as well.
I think we're on the verge of really changing things for human beings. Genetic testing, supplementation based on specific, instead of the shotgun approach. You know what I mean?
Yep.
Yeah, it's just now we're focusing on certain genes and things like that. And,
oh man, the gene site testing stuff is really incredible. I have a handful of clients that they'll do these gene site testings where it kind of gives you, like, if your doctor's prescribing medication, it'll give you like a red, yellow, or green light, right? Like how you may respond to a med or how agreeable it is with you. And I've seen that in some of my clients be like really revolutionizing for the way that they receive healthcare. So I think we are really, like, 2024, we're probably right on the edge of medical technology and fitness technology being something that really changes the way we live.
I don't know about on the female side, but on the male side, they're going to find, even in late 20s and early 30s, they're going to be supplementing testosterone.
Oh, for sure, probably.
And they probably already are, but I'm saying it's going to be more wide.
Yeah. Well, and they're doing definitely, like, there is like hormone replacement therapy for both men and women, right? Like, we think about, like, one of the major hormonal changes women go through is menopause, and after menopause you see like loss of bone density, loss of muscle mass, an increased risk for certain cancers and things like that. And they're now doing kind of like pre-testing your levels of estrogen and testosterone, and then customizing hormone replacement therapy through menopause, and it's preventing bone loss, it's preventing muscle loss, and so it's, I think, allowing people to live with like more robust, healthier, younger feeling bodies for men and women as we age. And I think that honestly has the potential.
And I think they'll find a lot more. I think this, like HGH.
Yeah.
I think that'll, all of it. And we're probably just scratching the surface right now. But you got to scratch the surface to get deeper.
Absolutely,
yeah. So anything what would you add? Hey, you got Joe Blow out there. He's 10 pounds overweight, 15 pounds overweight. He was a college what's co-ed sports athlete.
Yeah, like rec league guy.
Rec league guy,
sure.
But he's kind of laid off. He likes his beer on the weekends, sex life isn't quite what it used to be,
Yeah.
What would you just kind of throw out there for?
Oh golly,
Buck. No, I mean
yeah.
Joe Blow.
Oh yeah, right. I think like really starting small and doing fundamental stuff, like get out and go for a walk, get your friends involved, invite your friend over to do a workout with you, right? Like I think that things that are social and getting like lots of kind of moderate intensity activity in is like a huge fundamental part of like weight maintenance and things like that. Certainly alcohol is enjoyable. I think there's some moderate amount that can be fine with our health, and then over some amount maybe makes it harder to maintain maintain your weight. Yeah, that's
14 to 18 ought to be
so
okay.
you're keeping it under 20,
Yes.
you're probably good. Like just one handle, not two. And then I think beyond that, also like from a health and fitness standpoint, like getting your blood work done, right? Like I think that people do often find like, hey man, like I have no energy, and then it's like, well, you're really low on vitamin D, or your testosterone's really low, or
I never
you're
dreamed I'd be low on
deficient-
vitamin D.
You're incredibly you're incredibly deficient in iron or something, right? So I think like basic blood work is also kind of another part of that like making sure that you're kind of adequate on all of your basic nutrients can help, right? Because like I think sometimes if we're tanked on one of those, it makes it really hard to have the energy and the motivation to go train. And then every now and then it's like, oh man, now that I'm not anemic anymore, I feel really good when I work out. And so I think going for walks, doing some weightlifting twice a week for 30 minutes to an hour, and getting your blood work done covers a heck of a lot for most of us.
That's a pretty good path. One last thing, Patrick. What does running do for you?
I got a torn meniscus right now, so yeah, I can still run, just not at the distances I used to. So.
But is it physical or mental for you?
It's the longer distances are definitely mental because it's my therapy.
Yeah.
Yeah, absolutely.
I feel like working out is mental for some of us,
Oh yeah.
Because I can work through my problems in my longer distances. If I'm dealing with an issue, I go for a long run, and no music, no nothing. Yeah.
I probably maybe borderline addictive personality, and when I wouldn't miss a workout for any reason, I was just addicted to working out.
Yeah, right.
You know what I mean?
Right. You're kind of swapping one thing for another.
Yeah.
Well, and I think that is common amongst a lot of us, and I think some of us that become fitness professionals, right? Like I think that for me, certainly, like the thing that's probably kept me training more than anything is the psychiatric health component. It's like stuff can feel like shit. I go do a workout, I feel a heck of a lot better. They've actually done. There was a study published, and they looked at older adults, and they compared going to talk therapy, working out, or like doing both. And of course, like anytime you do both interventions, you see the most whatever. But when it came down to just talk therapy or just participating in exercise outperformed therapy environments for like mental health improvements in these people for anxiety and depression. And I mean, I'm not saying whatever, therapy is also good, but exercise itself really has a robust effect. And I think when it comes to that mental health side, like if you're not exercising, you're not giving yourself a fighting chance. It might not be enough for everybody, but it's a really big component piece for sure.
So a lot of what you do is athletically motivated, or for your clients.
Yeah.
But some of them, like, is there a place in what you do for post-traumatic stress relief or things like that? Like, is there a place to work that into? I mean, everybody knows, hey, working out, but again, a lot of these soldiers only know working out when they were 20 years old. And,
and somebody's like screaming at them to do
their
it too,
knees
right?
weren't bad, and their back wasn't, and their shoulders. You know what I mean? Now they're older, and they only know one way.
Yeah.
You know? But the exercise, like you said, would be extremely beneficial to the other things that they're working on mentally.
Yeah.
Have you ever thought of programs or branching into that sort of a?
Yeah, that's a really good question. A couple years back, there's an organization called Mental Health First Aid, and I think much in the idea that the intent of first aid is that you provide care until a professional can get to the situation, right? If somebody's bleeding out, you stop the bleeding until the ambulance comes in. This mental health first aid course was really a lot about recognizing some of these signs in people, teaching you how to have those uncomfortable conversations with like, hey man, are you struggling? Like, what can we do to connect you with resources? And so a lot of the times as a coach, I might be the only person that sits and listens to a person in a day, their hour at the gym may be the only hour where they're not having to meet the needs of other people and they have time to focus on the needs of themselves. And so I think that it is important that anybody that works in a fitness or coaching context spend time learning about engaging with people that are struggling with post-traumatic stress syndrome or anxiety or depression or any of that, really. And very distinctly, I had trained a fellow that had nearly frozen to death during the Korean War, and the personal training studio at the gym that I was working at the time was like whatever the temperature was outside. Like if it was hot outside and we ran the AC, the training studio was just like an ice box. And he got a little too cold one day and he no longer knew where he was. He thought he was in Korea, and he was having like a really frightening time. And I think that having done, this mental health first aid course, right? We got him blankets, we got him warm, and then I sat and I grabbed his hands and I looked at him and was just like, hey man, I'm here with you. This is where we are. You're safe. We're working out. Things are going to be okay. And I'll sit here and spend as much time with you as you need until we're past this. And so sometimes seeing and meeting the need of the person in front of you is more important than the workout, right? And then I think beyond that, creating a space where people feel comfortable and safe to, express like, hey, I am struggling, right? Because I think a lot of the times, especially for people that come out of military environment, there's a lot of this like, don't be a pussy, like, don't talk about it, man up, whatever.
Yep,
and I think
sure.
that providing an environment where it's like, hey dude, just because you've maybe seen some shit that no human being is really meant to see, and that doesn't make you weak if you're affected by it, and I respect you and I see you, and you can process that, and we can get our training in. I think that a lot of it, it's like the weightlifting stuff doesn't really, like what you're doing doesn't really matter. Like if it's CrossFit, that's cool. If it's jiu-jitsu, that's cool. I think that like anything physical and anything social is fairly well like a good backdrop for that. And then beyond that, it's having practitioners that feel comfortable. Like, I've had clients that are suicidal, and some of it is like saying like, hey man, I'm really concerned about you, or you having thoughts of suicide, and providing them the option to say like, yeah, I have. And then it's like, okay, can we connect you with help? Is that something you'd like to talk about? And I think being willing to sit with people and have those uncomfortable conversations and spend that type of time is really, really, really fundamental. And then I think creating communities where those people that struggle with it can also spend time together too, right? Like we have a program that I'm forgetting the name of it, CSC, that is for veterans with PTSD, and it gives you a free jiu-jitsu membership.
And CSC is where?
Combative Sports Center on 4th Street in Manhattan, Kansas.
Very good.
And so, I think there's programs like that, but I don't know if the fitness activity matters so much as the practitioners running the program and the community surrounding that.
The connections.
Yeah, the connections.
Yeah,
it's
and
all
the connections and
right?
physical activity.
Yep.
Yeah. So as Unbreakable Strength Company, obviously you have your lane, but you've said before you do other things around. So you have connections, and you can direct people to places.
Absolutely.
Like where locally, comes top of your mind. Where locally can you help? Coordinate and hook up people with friends.
Yeah. So I think, one, the Combative Sports Center is another place that I send people. KO Boxing is a place that I like to send people. And then,
Where's KO?
KO is,
It's
KO's in Manhattan. We are off of kind of Tuttle Creek Boulevard.
Yeah.
I forget the name of the street behind it, to be honest. I don't remember the exact address. But those are both great fitness communities in town
Still
that I
in
like
that
to
strip
send people
mall
to.
thing, though.
Yep.
Where the Mexican restaurant.
South side of town.
It is not there. Where?
No, it's not there.
There was Big D's Burger Shack, and now it's Anna's Burger Shack, and there's like, that's the top, and then around the back of the building there's a basement. And KO is
where
the
Combat
basement.
Sports used to be.
The old
way
CSC
back.
location.
Yeah, way back.
Yep.
Yeah.
So those are two fitness communities in town that I like to send people, and then there are a couple mental health resources in town that I like to send folks if I have somebody that is struggling, and then beyond that, like Cons of Strength is a great gym. They also have a lot of military personnel and a lot of veterans, and I believe they're run by 2 veterans, and so that also is a great place for folks as well.
Okay, so one more time, you run what?
I run Unbreakable Strength Co. And if you would like to train with me, you can visit unbreakablestrengthco.com or reach out to me on Instagram via Unbreakable Strength Co. Accept athletes of all ages, people struggling with disabilities or recovering from surgery, and I would love to work with you.
And just if they have questions,
Yeah,
same thing?
absolutely. Oh yeah, I'm always happy to answer questions. I Yeah, if you have any questions about training, DM me. I try to put continuing education content out on a regular basis. I write articles on my website. I have a newsletter, so you're welcome. You know, you don't have to be a client. You can subscribe to the newsletter, visit my website, and read articles. All of that's free. And yeah, reach out to me if you have more questions.
Hey, great points. Lots of fun.
Thanks, bud.
Appreciate you coming.
Oh, thanks for having
Pat,
me.
thanks for all your hard work, buddy. We're out.